Today we're going to talk about the ketogenic diet and its many health benefits. Prior to starting any diet, you must consult with your physician to determine if this is an appropriate diet for you and your health. There are a lot of different diets on the market that have been purported to have great health benefits. You have the low-fat diet, the no-carb, high-protein, the paleo, the autoimmune paleo, FODMAPs, GAPS, and the Mediterranean diet, just to name a few. So ketogenic diet, the basic premise is just to eat more fat. You want to decrease the number of carbs and protein, as our body will then burn fat for energy. Our body burns energy in two different ways. The primary way is glucose, and that's what we're all used to. So we burn sugar, protein, and the carbohydrates for our energy. The second way, which is basically what the ketogenic diet is based on, is we burn ketone bodies as an alternative energy source. This way it will burn the fat or the ketones for the energy. Now our body primarily will always move towards the glucose as our primary source for burning energy, because glucose, as we know, can be damaging to the body. It is inflammatory, and too much glucose in the body is not good. So what the body does, it has this regulatory mechanism that it will have you burn sugar primarily rather than fat. And then we know that the constant glucose in our body is the big driving force for this cellular inflammation, and then we get more aging internally, oxidative stress, and we can slow this down by more of a putting our body into a ketosis state, burn fat, reduce the oxidative stress, and in turn reduce the inflammation. There's a lot of research on the health benefits of the ketogenic diet. It is great for diabetics, it's great for epilepsy, chronic pain, fatigue, brain inflammation, brain fog, and even cardiovascular. So what do we eat? So what I would say is, to begin with, when you start the ketogenic diet, you want to keep your ratios of fats to carbohydrate, protein at a 1-to-1 ratio. With that being said, if you have 100 grams of fat per day, you need to eat a combined carbohydrate and protein 100 grams to maintain that 1-to-1 ratio. So, always the question is, well, what do I eat? So this is just an example. And so if you eat salads, just 3 meals a day, and salads gives you approximately 20 grams of carbohydrates, and then we subtract the fiber from it, which is about 20 grams. This gives you a net carbohydrate of 40 grams. Then the equivalent of a protein, like tuna, which that's the amount of protein you want to eat per day. This will give you 20 grams of protein each meal times the 3 meal equals 60 grams of protein. The combined protein and carbohydrate then is 100 grams of carbohydrate and protein together. To get the fats, a lot of our oils have really high fat content. So avocado oil, coconut oil, walnut oil. So if you just add 2 teaspoons of each one twice per day, this will give you 84 grams of fat. So then when you're eating the protein, this will actually give you some more fat, because even tuna and some of the meats and stuff you'll be eating has fat on it. So your net fat will be approximately 100 grams per day, and your ratio will then be approximately 1-to-1. Some other good sources of really high fat is coconut whole fat in a can. This gives you 65 grams. Coconut cream in a can gives you 80 grams. And you can sometimes spice these up with a little stevia, cinnamon, or cocoa powder to make it even taste a little bit better. Some of the really good foods, avocado has 21 grams of fat and only 5 grams of carbs and protein, so that gives you a 4-to-1 ratio. Macadamia nuts gives you a very high fat content to your carb and fat ratio, so it's a 5-to-1 ratio. So some foods that are not ketogenic that a lot of people end up eating are bacon, guacamole, ice cream, almond butter, peanut butter, cheddar cheese. And the reason why these aren't good, they have a lot of fat, but the ratios aren't good. And you want to maintain high ratios of fat to carbohydrate and protein, so you want to make sure you look at all the labels. There's a company, it's called Bulletproof Coffee. What this individual recommends is you add coconut oil or ghee butter to your coffee in the morning, and this will start your day in ketosis with a very high fat content. I do this, and eventually actually get used to the taste, and I put my body in the ketosis right away when the day starts. So you have to measure to determine if you're going into ketosis. So they have like ketone strips that can measure this, and sometimes it takes a couple days to sometimes a few weeks. And as I mentioned before, you got to make sure you talk to your doctor before implementing this ketogenic diet. There's an app, it's called the Cronometer, that you can put on your phone or computer that actually measures all the foods, the protein, fat, and carbohydrate content, and measures the calories, so you can maintain these ratios. So even if you don't want to get the ketone strips, if you know your ratios through the day are 1-to-1, 2-to-1, 4-to-1, then you know that you're putting your body into that ketogenic state. So initially you want to begin about a 1-to-1 ratio, and as you get more comfortable with it, or if you're really in chronic pain or have diabetes, they recommend more of a 2-to-1 ratio, and then for more severe conditions like epilepsy or cancer, you want to work up to a 3-to-1 or 4-to-1 ratio. So ketogenic has proven to be very good for longevity. It can turn on and turn off genes. It decreases inflammation, improves cognition. It has a lot of cardiovascular benefits, so it will decrease inflammation and will result in less plaque and clean the arteries actually. And our brain actually loves fat. It lines our membranes and our nerves. It helps eliminate brain fog, and the studies have been proven to help with epilepsy. It's also great with chronic pain. As we talked about, it lowers the level of inflammation and oxidative stress. It allows you to burn fuel more efficiently. You will actually lose weight on this diet, and it will lower your blood sugar. So if you're having a hard time getting into the ketogenic diet, sometimes they recommend intermittent fasting. And these days, there's a lot of research being done on intermittent fasting as far as the many health benefits. So they're saying that if you can stop eating right around 6 o'clock at night and don't eat till 12 the next day, again, you want to talk to your doctor. You want to make sure you're not a diabetic and other issues that can affect this, but there's tremendous health benefits. I used to be the individual that would have to get up in the morning, have breakfast right away, and now my first meal is about 1 o'clock in the afternoon. So our bodies, they get so used to things, you just need to switch it up once in a while. So here are some tips. If you do the ketogenic 5 days a week, you can do 1 day a week. You can do a bone broth or just do good oils, and then 1 day a week you can carbo or protein load so our body does not think it is starving. You don't want to go overboard with anything. You want to stay in moderation. And again, if you're having some chronic health issues, this might be something to look into and talk to your doctor about.